This is the busiest summer I have seen as a pediatrician for sure.
A bit of a surge in cold, COVID, and other respiratory tract infection type cases.
A summer sick wave paired with supply chain trouble is making it harder for us to manage cold symptoms for ourselves and our children. Back in the early spring, we saw the same problem, which appears to be back as a number of respiratory infections return. On Wednesday afternoon, we stopped at a number of pharmacies, large and small, right across the GTA, including Toronto, and found while some still had stock, others did not. The Vice President of Strategic Initiatives for the Ontario Pharmacists Association describes the problem as happening on a broad scale.
We are seeing a shortage of these medications through the supply chain, which is resulting in pharmacies not being able to reorder medications as people purchase them.
She points to a series of interruptions to the manufacturing of cold and flu medication.
And everything from the availability of raw ingredients to manufacturing of the final product and warehousing.
She says that, coupled with an increasing demand, is taking its toll. Adding demand could also be getting a boost by people feeling less willing to be seen as sick.
For a lot of people, I think it may be yes. If I'm out and about, I don't necessarily want to be sneezing or coughing because there could be some stigma attached with that.
It's unprecedented. The amount of sick kids we've seen this July rivals a typical January or February in terms of viral illness.
Dr. Dina Kulik is a GTA ER pediatrician.
So there's a lot of COVID illness going around, but also lots of other viruses as well, like hand, foot, and mouth disease and stomach bugs. And it might just be a matter of kids are really playing together again, mostly unmasked in close quarters.
Dr. Kulik says if you're having trouble finding medications for your kids, she doesn't typically recommend those anyway.
We do typically recommend acetaminophen or ibuprofen for fever or for pain, but cough and cold medicines are not something that we do recommend for young children. But we do recommend things like, saline drops or saline spray, using a suction to actually remove some of the mucus in the nose, using humidifiers.
Now, we did reach out to a number of pharmacies on the issue. Loblaw's in a written response acknowledging it, saying we are actively working with our vendor partners to manage the flow of goods and ensure shelves are stocked as product becomes available. Meanwhile, Jen Belcher says if you can't find the product of your choice, other pharmacies are still a good bet, or talk to the folks behind the counter.
They can provide good information about other medications.
In Etobicoke, David Zura, City News.